Director at HealthConnect One. Thank you for joining us at Birthing Hope, HealthConnect One's 2022 virtual fundraiser. Birthing Hope reflects HealthConnect One's vision to see every birthing family in the nation thrive. As an organization, we recognize that creating safe and sustainable communities begins with healthy moms, birthing people, and babies. Yet, in the past few months alone, our nation has mourned the loss of Black grandmas, uncles, dads, sisters, and moms at the hands of white supremacy and brown children due to gun violence, while simultaneously navigating through a formula shortage that has caused deep racial disparities in advancing breastfeeding intention, initiation, and duration. The preservation of survival of Black, brown, and Indigenous life, joy, families, and communities is core to our work. For the past year, we've continued to work towards ensuring people can give birth safely and future generations of Black, brown, and Indigenous communities can thrive. As families and communities grow, beautiful new babies remind us of the hope of new life, new joy, new love, new experiences, and a brighter future. Something beautiful to extend beyond our everyday experience. At HealthConnect One, we know how crucial community-based doulas, breastfeeding peer counselors, and community health workers are to birthing hope in Black, brown, and Indigenous communities. For 36 years, HealthConnect One has trained community leaders, ensured that birth workers' voices are lifted and heard, and created a national network of birth equity leaders. As we reflect on all the work we have led, we are proud to state that we have trained community-based doulas to foster thriving and sustainable communities, served as a funding intermediary for community-led work through resource mobilization and community convening, remained a resource for parents and families during the pandemic through virtual training and meetings, built relationships with other organizations and cultivated new skills by co-creating with our networks, and advocated and fought for fair pay for birth workers with birth equity leaders across the nation. The CDC released data that revealed a disturbing trend. Maternal mortality rates increased from 2019 to 2020 as our nation grappled with the COVID-19 pandemic. A long overdue emphasis has been placed where the energy is needed most, supporting Black women, birthing people, babies, and families who experience the worst birth outcomes in the nation. This emphasis includes Medicaid and private insurance coverage of doulas, sustainability that is long overdue for doulas and doula programs serving our communities. This will reduce racial disparities, advance maternal health equity, and improve health outcomes. Unfortunately, there are not enough community-based, culturally reflective doulas in the communities where the need is the greatest. HealthConnect One is committed to making sure that as doula reimbursement expands, there are community-based, culturally reflective doulas available to the communities who need them most. And we are counting on you and your generous donations to support the development of these programs. We know that HealthConnect One trained doulas make a difference in the lives of those they serve. Our recent results indicate our impact in the area where the need is greatest. Among Black women covered by Medicaid with the support of HealthConnect One trained doulas, the rate of low birth weight was 10.5% compared to 13.9%, the rate identified nationally for Black women. The prematurity rate was 11.2% compared to 13.9% rate identified nationally for Black women. And the C-section rate was 27.2% compared to the 35.5% rate identified nationally for Black women. Community-based doulas make a difference. Community-based doulas save lives. As we continue our work to break down barriers for birthing people, we envision a future with many possibilities. The HealthConnect One team spent time visioning and reflecting on our wish for future generations. Please enjoy our video of our wishes for future generations and share our collective hope for Black, brown, and Indigenous birthing families. Thank you.
My hope for future generations is for them to safely raise hope-filled children who feel liberated enough to pursue their dreams without fear of inadequacy, violence, or oppression.
My hope for future generations is to live in a society where Black, brown, and Indigenous communities are protected.
My hope for future generations is that they recognize the power of their voice, presence, and potential to impact change in their community and around the world.
My hope for future generations is for them to lead successful, thriving communities.
My hope for future generations is that families are able to thrive and not survive. And by survive, I mean not surviving barriers to care, not surviving inequities, and not surviving trauma.
My hope for future generations is that birthing people and mothers have access to equitable, affordable, and quality maternal care.
My hope for future generations is that they are able to have their ideal birthing experience without any fear of systemic trauma.
My hope for future generations is that they don't have to deal with the barriers and trials that are common to us today.
My hope for future generations is that birthing people, mothers, children, and families have mental and emotional support that is adequate and appropriate for them to thrive.
My hope for future generations is that everybody have the opportunity to start off on equal and fair ground.
My hope for future generations is a world that encourages productive youth. A quote states, "A nation without productive youth is a nation without hope, and a nation without hope is a nation without future."
My hope for future generations is that birthing families receive the support to be able to thrive, enjoy, and love, and support for their community and their families.
My hope for future generations is for them to be able to give birth without fear of racism.
My hope for future generations is the elimination of the strong woman syndrome.
My hope for future generations is that everyone will have access to the resources to not only survive, but also to thrive.
Good afternoon, and thank you all so much for joining us, as well as for your continued support of HealthConnect One's efforts as we continue to push forward in our mission. My name is Shambe Millian, and I'm with HealthConnect One. We'd like to take this time to highlight some of the work that we've been doing over the last year. As many of you may know, HealthConnect One was awarded a grant and has had the privilege of being able to lay the foundational work for the New Jersey Doula Learning Collaborative, or as we've coined it, the NJDLC. As of January 2021, doulas were able to enroll in Medicaid as providers for the state of New Jersey. Definitely a win and a step in the right direction. New Jersey currently ranks 47 out of 50 states for maternal deaths, a number we definitely desperately need to change. The NJDLC is part of Nurture New Jersey's strategic plan to address the issue of maternal mortality and the stark health disparities among the BIPOC population in the maternal health space. So what are some of the challenges that doulas have faced with Medicaid enrollment? Because as we know, with anything new, there'll always be challenges. So number one, the process is cumbersome and tedious. There are 5 different managed care organizations, or MCOs, in New Jersey, and each requires a different application process. The contract language and billing process are not designed for the average layperson to understand as an independent contract provider, which most doulas will be. As an example, one contract needed for a particularly large MCO is well over 80 pages. I'm not sure about you, but I don't know many people who aren't lawyers that are capable of navigating 80 pages of legalese. This process was designed for traditional providers who've had years of education in the field, as well as the resource and the backing of hospitals with billing teams and systems that they can pay for to support them. Also, the Medicaid reimbursement rate is lower than what's needed to sustain a long-term career path solely as a doula. And this rate won't change until we produce data showing a return on investment. Why is this a problem? Community doulas are specifically tasked with this work in New Jersey. As a community doula, you more than likely will live in and work in the community that you serve. And you can also face the very same issues as the populations that you're currently tasked with serving and helping. So we hope to ensure that these doulas are able to thrive in their career choice. As a doula myself, I know this is not just a career choice, but it's really what we consider a calling. So we hope that these doulas are able to be paid a fair and sustainable living wage in order to continue with this calling and this important work that they've chosen to engage in. The research shows the impact on Black birthing families when doula care is utilized. We've seen a reduction in preterm births by 19%, a reduction in C-sections by 23%, a reduction of low birth weight by 23%, and an increase in breastfeeding and retention rates by 22%. Doulas are truly magical. What other initiatives do you know that can produce results like these? Clearly, the return on investment is there. However, we need to ensure doulas can enroll and provide services for that ROI to be seen and documented. This is not an easy feat, but it's one we're gladly undertaking. New Jersey has approximately 50,000 Medicaid births annually. However, there are currently less than 100 doulas enrolled as Medicaid providers. We know that Medicaid enrollees continue to be disproportionately affected by poor birth outcomes. With the NJDLC project, we will continue to strive to make progress not only for the families that are served by doulas, but for the doulas themselves. Yet another project we would like to highlight is our work nationally with managed care organizations. HealthConnect One currently partners with a national MCO, currently working within 8 states on Medicaid reimbursement for doulas. 2 of these states currently have legislation around Medicaid reimbursement, while 6 are building pilot programs with the hope to produce results that will lead to doula care being a value-added benefit for Medicaid recipients. So what does this mean? Well, we know that the population that utilizes Medicaid tends to be those who also face various social determinants of health, many of which may adversely impact birthing outcomes and subsequently the ability for families to be able to flourish in their environments. Our hope is that through our work with managed care partners, doula care will be made available to the most vulnerable and at-risk populations at absolutely no cost to them. We want all families to be able to receive the support that they need, not just to survive, but to truly, truly thrive all over the country. With your continued support, HealthConnect One can continue to do the work to push the needle forward and address these issues. Thank you so much for your time. We'll move forward with the next portion.
Now I have the honor to introduce our keynote speaker, Kimberly Seals-Allers. Kimberly is a femtech founder, writer, speaker, and maternal and infant health strategist with a bold vision to transform the experience of motherhood for all and eradicate racial disparities in birthing and breastfeeding. Let's give a warm welcome to Kimberly.
Hello, everyone. I'm Kimberly Seals-Allers, and I'm so excited and so honored to be here as part of HealthConnect One fundraiser today. You know, I was so moved and inspired by the theme of birthing hope, because when we think about all the things that we need, hope is certainly one of them. But we know that our hope doesn't need to be or shouldn't be foolhardy. Our hope needs to be rooted in a strong foundation. Our hope needs to be based on something really strong, right? And really able to carry the weight of the hope that we have, particularly for Black and Brown birthing people. And so when we think about the need and the critical importance of birthing hope, then we have to think about that foundation being rooted and built on community-centered solutions and ideas that are rooted in the community, that being a critical part of how we can truly birth hope. And that's why I'm so honored by and encouraged by the work HealthConnect One is doing, particularly around their community-centered programs and initiatives, the ways that they center their work for all mamas and babies to thrive. This is how we can truly create not just hope, but outcomes that can transform the lives of all birthing people and their families. That is truly our goal. And so, excuse me, I am excited to be here with this fundraiser that's not only celebrating those community leaders and the advocates who are taking part in all of this tremendous work that allows us to be hopeful, to feel hopeful, to think hopefully. I am also honored to be talking about the role that community-centered solutions can bring in driving more accountability and transparency, right? It is indeed the only way forward. There is no equity without transparency and accountability. There is no hope without transparency and accountability. And it is my fervent belief in this that has grounded my work, even with the Earth app, in creating this first of its kind Yelp-like tool for Black and Brown women and birthing people to find and leave reviews of their OBGYNs, birthing hospitals, and pediatricians. If you're not familiar with Earth, and it's like the word birth, but we dropped the B for bias, it is an important nonprofit platform to not only allow us to inform and protect each other by sharing publicly where we are getting good care and where we are not, but it is also the first of its kind data aggregator that allows us to turn these reviews into meaningful and actionable data to help improve working with hospitals, payers, and providers so that they can improve their systems by quite simply learning from the living, not waiting for another maternal death to decide that the care that's being offered needs analysis, that it needs to be looked at. And so, you know, really thinking through all of these pieces together is so critical in how we can truly have hope that's not just kind of fanciful and wishful, but hope that's based on the work that's being done, hope that's based on the systems that are being held accountable, hope that's based on the transparency that we know drives equity that can help all birthing families thrive. That is really how we truly birth hope. We must be aware if we are really birthing hope. We have to be aware, right, of this critical need. We must be expectant of the systems to do their work as well, not just putting the burden on birthing individuals to carry that load, to advocate for themselves. We must be aware of the role that doulas play, and not just thinking about the doulas themselves and their value to the individual birthing person, but their value as we build a new evidence base, right? A new evidence base that we can build this hope from, that includes not just over-indexing the people who are being disproportionately harmed, but also includes the observations and work of doulas, many of whom have been trained through HealthConnect's amazing programs, right? In the Earth app, we even have a special icon because doulas are welcome to leave reviews in the Earth app about their observations and experiences. And we have a special icon in the app so that users know that a doula who has likely seen more than one birth at that particular hospital has an important perspective. And so as we are creating these community-centered solutions, how do we lift up the solutions that we say matter? How do we show that we appreciate doulas, and that we understand their true value, and that we bring that into everything that we do, including what we're building around our research and this new evidence base. So these are the elements that are critical to how we can truly birth hope. And I'm so honored and excited and encouraged by the ways that HealthConnect One has been taking a lead in honoring this work and honoring this way of doing. Remembering that we cannot go back to the same old, same old. We cannot continue doing what we have been doing, expecting different outcomes. Black women continue to die disproportionately during pregnancy and childbirth, and far too many, the greater percentage of those are unnecessary and preventable, right? And for us to be hopeful, we have to be aware that there are real serious outcomes and initiatives out there that are pushing for change. And that is firmly what I believe. And that's what I believe that HealthConnect One is doing. So I hope that everyone is enjoying the fundraiser. I hope that everyone is supporting the great work that HealthConnect One is doing. And then I hope that we all remain hopeful, right? I hope that we all remain hopeful. And just like we're birthing hope and we're birthing new outcomes, that we keep pushing. We keep pushing for that transparency and accountability, because we know that will truly birth not just hope, but thriving families and communities. Thank you so much.
Thank you, Kimberly, for those kind and beautiful words. Gracias. So the Durban Year Award recognizes community health workers or organizations who have made a great impact in maternal child health over the last 3 years. The Durban Award is named after Senator Richard J. Durbin from Illinois. Senator Durbin has demonstrated his support for community-based doulas and breast, chest feeding peer counselor models, and has helped bring awareness to the value of perinatal community health workers nationwide. So we're so grateful for his support. This year, we are providing this prestigious award to Comunidad Materna in Utah, a grassroots organization that provides support to Latina monolingual Spanish-speaking community by providing peer support in lactation and community-based doula services. So it is such an honor to be able to present this award to Comunidad Materna in 2022. Gracias. Thank you.
Thanks for inviting me to join you today at HealthConnect One's annual event, Birthing Hope. What began as a volunteer effort to promote breastfeeding, HealthConnect One now partners with countless organizations to address maternal and infant health disparity. This issue is close to my heart. For years, Congresswoman Robin Kelly of Illinois and I have introduced the MAMA Act, a bill to improve maternal and infant health outcomes, particularly for women and babies of color. Black babies are twice as likely to die in their first year of life compared to white babies. And Black women are 3 to 4 times more likely than white women to die due to complications in childbirth. From 2019 to 2020, the maternal mortality rate for Hispanic women jumped by 44%. And listen, we're one of the only countries in the world where maternal mortality, the death of mothers, is worse today than it was 25 years ago. How can that be in America? It's just unacceptable. But thankfully, HealthConnect One is focused on addressing these problems and challenges and saving lives. It's my pleasure to congratulate this year's recipient of the Senator Richard Durbin Community Health Worker of the Year Award, Comunidad Materna in Utah. They are meeting people where they are, in their homes and communities, providing culturally sensitive care and helping connect expecting families to clinical resources like individual mentoring and doulas. These efforts are paying off. Healthier babies, empowered mothers, thriving families. We need to build on this. These mothers and babies need our support now more than ever, and the staff of this project have met the moment during these difficult times. Thank you for your work and for leading the charge to create a safer and more equitable nation. Please join me in congratulating Comunidad Materna in Utah.
Thank you, thank you. My name is Mayra from Comunidad Materna in Utah, and today is an honor to be here with you. We appreciate this opportunity to be here and be part of this birth worker movement and see how it's moving forward. Comunidad Materna in Utah was born in 2017 as a nonprofit organization with a vision to improve the well-being of mothers in the Hispanic community. Mostly of our participants are immigrants who face several barriers in the community and understand the system, access to affordable care, and having cultural sensitive support during pregnancy, birth, and postpartum. Our services are provided in Spanish. Our collaboration with HealthConnect One has been give us a hope for opening more educational opportunities for our doulas and expanding the knowledge. And right now we are working to train peer counselor, breastfeeding peer counselors. We are doing outreach on breastfeeding to support our mothers. Our hope, my hope, is closing the gap between the community and the system and having the services focused and follow up during pregnancy and childbirth and postpartum and open opportunities for more doula work. As a birth workers, we face different challenges and recognition and support. But we know as a team, we can work together to provide these opportunities and support system. And we appreciate this opportunity that is HealthConnect One is giving to us. This recognition is a result of a team effort that collaborates with Comunidad Materna in Utah and is a symbol of hope and improve to improve emotional health and physical from our mothers and babies. And thank you so much, Senator Durbin, and thank you so much, HealthConnect One.
Greetings, everyone. My name is Paula Aguilera, and I am the Development and Donor Engagement Manager here at HealthConnect One. Thank you all for joining us today. We would like to take a moment to thank everyone who has also donated to our fundraiser. As of right now, we have raised close to $32,000. And for our 36th anniversary, we have a goal to raise $36,000. These funds will allow us to continue training, educating, and supporting people in communities. Help us birth hope for babies and families by donating to HealthConnect One today. Your generous donation helps balance the scales for birthing Black, Brown, and Indigenous families and the birth workers supporting them. Join the community of donors and leaders who are making a difference. People like you who are committed to racial equity. People who are committed to hope. Join our movement by clicking the donate button below. Thank you.
Hello, everyone. I'm Z, the Vice President of Impact and Advocacy at HealthConnect One. We're so delighted to have you all here with us today. At HealthConnect One, we are working to spark change and mobilize change makers for birth justice by partnering and collaborating with Black, Brown, and Indigenous communities that experience the greatest inequity in our nation's current maternal and child health crisis. We are partnering with Black, Brown, and Indigenous doulas, breastfeeding peer counselors, and other community health workers as they advocate for themselves and the people they serve to build healthy communities and strengthen our country. And as our country grapples with pandemic-related challenges and a movement toward racial and social justice, the time is now to support and advance outcomes that build healthy communities. With the support and groundwork of birth equity advocates in our network, we're continuing to fight for fair pay for birth workers, reproductive justice, and sustainable communities for future generations. Our advocacy platform is streamlined to focus on 3 key actions: support and promote the equitable payment of community-based doulas and breastfeeding peer counselor programs nationwide, engaging community leaders and stakeholders to promote a team approach that includes trusted community health workers, community-based doulas, and breastfeeding peer counselors, and finally, encourage public-private partnerships to advance fiscal sustainability of community-based doula and breastfeeding peer counselor programs. Sustainability and fair pay are critical to support ongoing quality care that advances maternal and child health. HealthConnect One uses evidence-based practices and team expertise to build sustainable models that improve birth outcomes, breastfeeding rates, and economic mobility for community members. Further, sustainable pay is only one element of our work to create change for birthing families. In connecting with doulas, peer counselors, and other community health workers, we have compiled stories and information from families across the nation that highlight the extreme problems and harm families are facing. These problems, in addition to managing the staggering loss and unpredictability of the COVID-19 pandemic, has left Black, Brown, and Indigenous communities with additional stressors, causing strain on overall community health, community well-being, and especially mental health. We recognize the positive impact of relational and perinatal support delivered by doulas, and as a result, we're partnering with the Center for the Study of Social Policy to develop a community-based doula training curriculum that deepens the foundational impact of early relationships between children and their caregivers. It also highlights the justice-oriented, resiliency-building, and relational focus of peer-to-peer support in communities. Our Early Relational Health Collaborative project provides an excellent opportunity to highlight racial, restorative, and reproductive justice within community-centered approaches, and will also foster hope by strengthening familial bonds through peer-to-peer support. The project will train over 300 doulas across the country, reaching over 6,000 birthing families during the critical perinatal period and up to 12 months postpartum. This is an important window of opportunity through which early relational foundations can be reinforced. The Early Relational Health Collaboration elevates the positive, culturally reflective support community-based doulas offer by building and partnering and collaborating with communities. We hope to bring an early relational health curriculum and program that impacts families in meaningful ways, ensuring their success, overall well-being, and joy within the first 1,000 days of life and beyond. Together, I really believe, and our whole team believes, that we can build a system that supports healthy communities today and for future generations. Through advocacy, we are improving maternal child health outcomes and building healthy communities. But we're not alone in this work. Collaborators and partners such as Kay Matthews continue to birth hope for birthing families through education, advocacy, and respectful care. Her organization, Shades of Blue, is dedicated to helping birthing individuals of color whose lives are impacted by racial disparities that heighten their birthing challenges. I am pleased to pass the mic to Denise from the Irving Harris Foundation, who will present the 2022 Irving Harris Advocacy Award to this fierce advocate. Thank you.
Hello, HealthConnect One family and friends. Congratulations to HealthConnect One on their 2022 Birthing Hope annual event. My name is Denise Castillo DELL ISOLA with the Irving Harris Foundation, and I'm thrilled to be with you today. It is my distinct honor to help celebrate the recipient of the 2022 Irving Harris Advocacy Award. As you know, HealthConnect One is a national leader working to address inequities in birth experiences for Black, Brown, and Indigenous communities, and to eliminate racial disparities in maternal and child health. The Irving Harris Advocacy Award is given to individuals and organizations making an impact on maternal health and birth equity. And we are excited that HealthConnect One is recognizing Kay Matthews, founder of the Shades of Blue Project, for her leadership and advocacy in the field. Kay and her team at the Shades of Blue Project are on a mission to uplift all birthing individuals with the care, respect, and dignity they deserve, no matter their social status or birth outcome. They seek to improve maternal mental health outcomes for Black and Brown birthing people. Kay and her team focus on the birthing experience, honoring and acknowledging everyone's birth story. Kay comes to this work from her own deep and personal birthing experience. She is actively teaching and speaking to women of all ages to help them understand how important it is to advocate for themselves before, during, and after childbirth. Through education, advocacy, and support, Kay and her team are dedicated to helping birthing individuals of color whose lives are impacted by racial disparities and amplifying their birthing struggles. Please join me in celebrating HealthConnect One's 2022 Irving Harris Advocacy Award recipient, the remarkable and inspiring Kay Matthews.
Thank you, thank you, thank you. I would first like to say thank you to the HealthConnect One team, as it is my honor to accept this award. Although I've never been one for accolades, today in this moment, it's different. I'm thinking about the scared first-time mom I was in 2013 and how the death of my daughter during birth changed the trajectory of my life in ways I was truly not prepared or equipped to handle. I just remember how I told myself during the most difficult time in my life that when I made it to a healing and recovery state of mind, that I would work my hardest to figure out a way to ensure that other women and their families don't suffer in silence or out loud, and no one knows how to help them. From that commitment I made to myself and my will to survive, the Shades of Blue Project was birthed. This journey of building and creating spaces where no matter your birth outcome, you are given love, kindness, respect, and most of all, support that you need is the very outcome I have been forging ahead to ensure happens on a daily basis through our organization. Today has truly unearthed the emotional side of me that simply wants to scream, I deserved better. And with those sentiments, my team and I will continue to work so that we not only feel we deserve better, but that we actually get it and it becomes reflected in better birthing outcomes and experiences. To all of you here, I must say, support the work that HealthConnect One is doing and so many others of us that are out here. Because believe me, someone's life truly does depend on it. Again, I am humbled, I am grateful, and most of all, I am encouraged to keep pushing and making shift happen. Thank you.
I love that. Making shift happen. Kay, you're awesome. Thank you for sharing. Through all of your support, we can provide sustainable and crucial technical support, training, and advocacy to culturally reflective birthing supports, for Black, Brown, and Indigenous babies and birthing families. We are so grateful for all of our sponsors, donors, and supporters who made our 2022 virtual fundraiser, Birthing Hope, a huge success. Thank you so much for joining us today, and have a restful and rejuvenating weekend.